It's lovely man though.
Good morning, everyone. We've got 19 new cases overnight, 12 of them linked, the remainder under investigation. But the majority are close household contacts. 4 of today's cases were in quarantine during their entire infectious period, and at least 13 have spent part of their infectious period in the community. We've got 12 people currently hospitalised. 3 are in intensive care and 2 require ventilation, and 2 of those patients are New South Wales residents. Testing yesterday, 3,455, so a very solid number. Thank you to everyone who came forward. Just a quick reminder that if you have any symptoms, please get yourself to a testing centre as soon as possible. On the vaccination front, we've reached over 83.5% of our eligible population with at least a first dose of a vaccine, and approaching 57.5% of the eligible population have now received 2 doses. The national data shows that when compared with other states and territories, the ACT is one of the national leaders. Canberrans are getting vaccinated in high numbers. The majority of our older age cohorts, that is those who have had the opportunity to get vaccinated, are at greater than 95% with a first dose. This will put us in a better position in the weeks and months ahead. Pleasingly, we continue to see exceptionally strong demand from 12 to 15-year-olds for the vaccine. There are 20,000 in this age cohort in the Territory. We believe these young people should have the opportunity to get vaccinated, and many of them received their first dose of the Moderna vaccine through our community pharmacy network yesterday. Supply of the Moderna vaccine will continue to increase in the coming weeks. There will be many more opportunities in the days ahead for that age group, and indeed anyone 12 to 59 years of age, to make a booking for the Moderna vaccine at a community pharmacy. So please take up these opportunities. It may be the quickest pathway to getting fully vaccinated. I also encourage people to keep looking on the My Digital Health Record website in order to see whether there might be an earlier Pfizer appointment available at one of the ACT government mass vaccination clinics. As part of next month's ACT budget, the government will make further significant investments in our public hospitals to support our short and medium-term pandemic response and for the long term. The budget will increase funding to operationalise the expanded intensive care unit at Canberra Hospital. It will also provide improvements to the Canberra Hospital Emergency Department and provide funding for more emergency surgery capacity. Construction works have been underway for 8 months to expand the physical capacity of the intensive care unit. Completion of this construction work is scheduled for December of this year and will provide increased access to life-saving care as demand from COVID-infected patients grows in the first quarter of 2022. The expanded intensive care unit space provides for additional surge capacity as it is required. A significant portion of the new funding the ACT government is announcing will be used to staff these new beds. This investment, though, is a permanent expansion of capacity in the intensive care unit at Canberra Hospital, and beyond the pandemic, it will cater for increased demand across the ACT and southern New South Wales. Minister Stephen Smith will provide some further details of this budget announcement shortly. So in summary, for those who've joined late, 19 new cases overnight, 12 of them linked the majority close household contacts. Unfortunately, only 4 were in quarantine in their entire infectious period, and at least 13 were infectious in the community. 12 people are hospitalised and 3 are in intensive care. Dr. Coleman will now provide an update on the new cases and epidemiology, and then Minister Stephen Smith will provide an update on the budget announcements today, and then we'll all be available for questions. Thank you.
Good morning, everyone, and thank you very much, Chief Minister. So the total cases for this outbreak is now 693, with 19 new COVID-19 cases notified since our last update. We now have 476 people recovered from COVID-19, so that's an additional 13. Our team continues to manage 217 active cases. So of the new cases today, I can also confirm that of the 19, 12 can be linked to known cases or ongoing clusters, and we know that 9 of these are household contacts. For the remaining 7, we are still undertaking that early investigation for links to known cases and clusters. And of the total 19, 4 were in quarantine for the whole of their infectious period. 13 did spend some time in the community for at least part of their infectious period, and 2 we're still investigating. To 8 p.m. last night, we have 12 people in our hospitals, 3 of these in ICU, with 2 of them requiring ventilation. Of the total 12, 6 are unvaccinated, 3 have received 1 dose, 1 is fully vaccinated, and 2 we're still confirming vaccination status for. Of our total 12 in hospital, their age ranges are from 30s to 90s. We now have over 950 self-identified close contacts and over 450 active exposure locations. So 2 of today's cases are linked to the Calvary Hayden retirement community. One of these is the aged care worker that you already know about, and there is an additional case as part of our numbers being notified. But not included in today's numbers are several additional cases that we have been notified about overnight. These are currently under investigation, and I'll be able to talk more about those exact numbers tomorrow. Our team are currently undertaking this assessment process, and we're making sure that all the appropriate notifications have been made. And as per normal practice, you know, I don't like to talk about specifics of numbers here until I can confirm that all of the relevant people have been notified, that they are a case, and their household members have been notified as well. So the additional case in today's numbers is a staff member, and I can also confirm that these 2 cases captured today are fully vaccinated and were in full PPE when appropriate while at the facility. Look, I absolutely understand that this may be distressing news for the families and residents at the facility. We are working very, very closely with Calvary, who are communicating directly with residents and their families regarding the outbreak and keeping them up to date with the actions Calvary has taken and will be taking to ensure that the residents are kept safe and for their well-being. Families will continue to be provided updates as we move forward. The facility will of course remain closed, and the full risk assessment will continue with our actions guided by that. Additionally, over the weekend, you may see that we'll be conducting some pop-up testing in the Watson area. So as part of the ongoing management of our outbreak, we've talked before about how we constantly watch about where the cases are, where they actually are, their locations, and the links to inform our response. We look at the genomics, we look at the epidemiology around the links between people, but we've also been looking at the geographical or location-related links to see if we can see any kind of geographical clustering. What we have noticed in the last day or 2 is we have 30 cases during the outbreak from the Watson area, and almost half of those have been notified in the last 2 weeks. But in addition, we're actually unable to confirm the source transmission for some of these cases, And as you know, unconfirmed chains of transmission are what is the major concern for us. So just to be clear, I don't know that there is a problem here. We don't know that there's a concerning level of transmission within the community from these cases. But what we do know from New South Wales and Victoria is that we need to move very quickly to give people the opportunity to get tested so that we can understand and detect if there is something that we need to do something about. So we have noticed both New South Wales and Victoria providing focused, targeted testing teams under an arrangement of different arrangements, including going to specific locations. So we have learned our lessons from the other jurisdictions in the ACT. We have planned to do this and we are well set to stand this up. So over the weekend, we will be proactively setting up additional testing. Excuse me a minute. This is for anyone who lives in the Watson area, for anyone who has the mildest of symptoms or that they are concerned that they may have been exposed in their household or otherwise to COVID-19 to come and get tested. Just note, this will be in addition to our other testing sites, including Epic, which is very nearby. And the purpose of this is to assist people who haven't been able to get to Epic testing or any other sites nearby, or actually can't get tested at the other sites. So this facility will be able to test our children under 5 years of age, so it may be easier for families to go. So all of the information regarding this testing will be available on our website and social media channels later today. We are just working through all the exact planning arrangements at this point in time. So if you live in the Watson area, please keep an eye out for that information. And today, my shout out is to all of the friends, families and loved ones of people who are currently in hospital, aged care facilities, or places where because of COVID-19 visiting your loved one is not possible and hasn't been possible for a little while. I really understand that you want to be able to visit and be with your loved ones, and that not being able to do this is really tough. So I do thank you very much for bearing with us as we work through this outbreak in the ACT. And I can assure you that we are working on opening up these facilities to visitors as soon as it is safe to do so. Thank you, and I'll hand over to Minister Stephen Smith.
Thank you, Karen and Chief Minister. Good afternoon, everybody. Today, the government announced new funding to support the expansion of the Canberra Hospital Intensive Care Unit, as the Chief Minister talked about, also to deliver operational improvements for the Canberra Hospital Emergency Department and to fund more emergency surgery capacity. The Emergency Department, of course, is the front door to Canberra Hospital for so many people, and the team there does an incredible job in supporting people from the ACT and our surrounding region when they need urgent care. The intensive care unit's physical expansion is due to be finished at the end of this year, and these upgrades will provide more access to life-saving care, acute medical treatment and intensive care monitoring. We'll be providing an additional $28.4 million to operationalise an additional 4 beds in the intensive care unit. This means there will be more staff on hand to support our most unwell patients. The ICU expansion also provides for further surge capacity, and we will not hesitate to open more beds if required as part of our response to COVID-19, or indeed as we see surges through the winter months, which is usually what occurs. We're also providing a further $22.9 million to support an expansion and improvement of the emergency medical unit, as well as the introduction of a new acute medical unit and an increase to the health workforce across the emergency department and related areas. The acute medical unit will enable patients with multiple medical issues to be admitted faster and more efficiently from the emergency department into the hospital and to have their care plans commenced by a multidisciplinary team. And this responds to feedback that we have seen from the emergency department, where more people are presenting with comorbid complex conditions that take some time to work out what the primary issue is that needs to be responded to and how their other conditions can be managed at the same time. This model of care has been developed through extensive consultation, and of course there will be further consultation with staff as we work to stand up the acute medical unit. The funding also provides for a medical navigator, a highly skilled nurse who works with the senior medical team to ensure that patients are cared for in the right emergency department location and to support the admission process and facilitate transfer to the right inpatient ward. We've also committed $39 million to deliver an additional 1,920 emergency surgery theatre hours per year and 8 surgical beds to improve surgical outcomes for patients. Again, we've seen a significant increase in demand for emergency surgery over the last couple of years, and we're not alone in this. We've talked a number of times about the increase in demand that hospitals across the country are seeing, and this includes, for many of them, an increase in demand for emergency surgery. So we've responded to that feedback from both consumers and our staff about the impact of this increased demand for emergency surgery on both access to emergency surgery and also access to elective surgery and what we have seen in postponement of that on occasion. So I'm really pleased to be making these additional investments in the Canberra Hospital so that we can deliver the right care at the right time for residents of the ACT and our surrounding region. Before I hand back to the Chief Minister, I want to make a big shout out today to the residents of Ainslie Village who have been in quarantine for some weeks now. For most of those residents, their quarantine was lifted at midnight last night. There are a small number of residents who will have to remain in quarantine a little longer as they continue to be identified close contacts of more recent cases. And I particularly want to thank them for their patience and for the way that they are collaborating with our ACT Health team and the recognition that they have of how important their quarantine is. We've talked before about how challenging quarantine can be, particularly if you're in an apartment or, in this case, in spaces with a lot of communal living where people have, in many cases, been confined to a single room for a period of time. And we know how tough this has been for many people. So a big thank you to the residents and also a big thank you to the team that has been supporting Ainslie Village over the last few weeks. This includes staff from the ACT Health Directorate, Canberra Health Services, Housing ACT, the Community Services Directorate, Emergency Services Agency and ACT Policing, as well as our community partners, Argyle Housing and Vinnie's, who operate at Ainslie Village all of the time, Directions Health Services, Karma, Hepatitis ACT, Atoda, ACT Shelter, the Mental Health Consumer Network, Healthcare Consumers Association, Community Options and Community Services One. All of these organisations have worked together to deliver a multi-agency response in Ainslie Village that will be stepped down over the next few days for most residents as we continue to support those who remain in quarantine. So thank you again to everybody involved and to Ainslie Village residents yourselves. And with that, I'll hand back to the Chief Minister.
Thank you, Rachel. If the mask would help. Happy to take any questions.
Chief Minister, will the ACT follow New South Wales with a pilot program of its own to bring back international students?
I don't think we'll need a pilot program. I think we'll move more quickly than that, but in 2022.
Fairly crucial to the ACT economy, the university sector. Have you an idea of how many students you'd like to see coming back at this point?
Well, it depends on what the Australian government puts in place in terms of international travel and what the quarantine requirements will be. But if we look at trying to get international students back, not in a handful, but in much greater numbers for the commencement of Term 1 2022. That's a goal worth working towards.
Do we know if any of the students in this initial pilot will be coming to the ACT via
I
New South
don't
Wales?
believe so, no.
It's been reported this morning, Chief Minister, that the ACT's supply of Pfizer is set to fall from 218,000 doses to 156,000 doses between September and October. Can you confirm that that's the case, and do you have any lingering concerns about the supply issues with Pfizer to the Territory?
We hope that's not the case, and we've been engaging with the Commonwealth say over a number of days now in order to try and avoid that, and I'm optimistic that we may be able to reach a better outcome for the Territory, and we want to continue that engagement with the Commonwealth.
We're at that 1 month mark now since applications opened for business support grants. Are you able to give an update as to how many of those have been processed and paid out?
Yes, so we'll cross over 4,000 payments being approved today. That's the advice I have, and that the value of approved payments will cross over $60 million. Of the 1,600 applications that were submitted on the first day, I'm advised that 75% have already been paid. There is a small percentage, less than 1%, that were declined because they were ineligible, and that the number of applications that needs further information has now halved to a little over 1,200. So significant progress has been made on that front. We're 22 business days into the process, and we will continue, obviously, with a team working across the entire working week and weekends. But in terms of business days, we're 22 days in.
Still sounds like a substantial number of those applications on the first day, though, haven't been processed. Well, nobody, I'm sure, doubts the intent of this grant's progress, and you've said previously that around 100 staff have been working on this. Do you need more staff working on this to get these grants through?
No, we need complete applications. So we could have paid the other, so there's about 400 that were lodged on the first day and that haven't yet been paid, and they're mostly because we don't have the information that's required to make the payment.
Has these businesses been spoken to and told about the shortfalls?
So they've been advised repeatedly by email and often by phone call. Now, I have received some feedback that some businesses have had the email and, in fact, a number of emails from the grants team have somehow got caught in spam filters for individual business email accounts. So that was a reason why some businesses thought they hadn't heard anything back from the government. They then went and checked their emails and it was there. In order to overcome this, a further team has been stood up to make phone calls to those businesses that are yet to submit all of their information that's necessary. Now, things that have not been submitted or have been problems over the course of this have been incorrect bank details. We've had payments bounce back, or there have been circumstances where the ABN number on a quick ASIC check has proven to be not related to that business, or the business is insolvent, or the business has been wound up. So, as has been experienced in other jurisdictions, a very small number of applicants have sought to game the system. But we indicated that 30 days would be the time frame that we would be seeking to make payments. I've looked at the comparison with New South Wales by way of a benchmark. So New South Wales got their first case on the 16th of June. They announced their lockdown on the 25th of June. 4 days after their lockdown commenced, on the 29th of June, they announced their business grants package. They didn't open applications for 24 days from when the lockdown commenced to when people could start making their grant applications, which were opened on the 19th of July and then on the 26th of July for their micro-business grants. By comparison, the ACT lockdown was the 12th of August. Our business support grant program was announced 1 day later. Our applications opened within 14 days, not the 24 days that New South Wales took, and we made our first payments within 10 days. I note ABC News reported on the 20th of August that 60,000 New South Wales businesses were still awaiting lockdown payments 9 weeks into the lockdown. So this is a challenge for every state and territory. And the reason is that a business grants scheme like this, which is the largest grant scheme ever in ACT history, is not the most administratively efficient way to deliver support to businesses, because it requires an application and assessment process, the provision of ABN and bank account details that the Commonwealth Government already has and was utilised effectively last year for the JobKeeper scheme. So my issue with what's been forced upon us by the Commonwealth is not that we're paying 50%, but that they forced this payment mechanism. We would have happily funded 50-50 the business support grants to the same magnitude of dollars, but it would have been much more efficient to deliver it through the Commonwealth, existing Commonwealth mechanisms. Now, it's not just me who's made this point. My New South Wales Liberal Treasurer counterpart did exactly the same thing. So I appreciate there's frustration, but our program is running ahead of the equivalent New South Wales program, with more money delivered more quickly than New South Wales have been able to do. But it is not, I acknowledge, it is not the most efficient way, but it is the situation we find ourselves in because the JobKeeper arrangements were wound up last year.
You're satisfied at this point with the processing speed of these? You're not looking to put extra stuff on?
The issue is incomplete applications. Those that have been correctly filled out have been paid.
Chief Minister, you've repeatedly described vaccine mandates as a solution in search of a problem in the ACT. Given there is now an outbreak in a health facility at Calvary, is there any circumstance in the ACT where mandatory vaccinations might be required? And have there been any representations to the ACT government from professional bodies calling for such a mandate?
Well, there is in aged care, and the evidence would appear that fully vaccinated people, both staff and residents, can catch the virus and get infected. So what we will see play out in those individuals is hopefully that the vaccines protect them from serious illness. So mandates in and of themselves don't guarantee that you won't see infections within particular workplace settings. So to the extent that we have an example in a mandated workplace environment where there's been transmission between vaccinated people, that does obviously raise a few questions, but reflects the reality of this virus.
Back on businesses, as you mentioned, we're doing better than New South Wales, but that's surely small comfort for those businesses here who still don't have access to those payments. What we're hearing is that, it's a lot about missed, boxes or incomplete applications. Is there no way that we can better support businesses through the process, better communication? A lot saying that they just submit an application, don't hear anything, and it's been, several weeks with no pay.
Yes, we contact people. We've been ringing, there's 8,000 applications, so we've been ringing businesses individually. That's obviously a lot of people and a lot of time to talk people through. Now, the overwhelming majority of businesses have been able to complete the form and put in the information. It's relatively straightforward. And they're the ones who've been paid. They're amongst the 4,000 who've been paid. The issue is incomplete information. And so we get back in contact with people. We do it through a variety of both written and verbal ways. And then as soon as the information comes in, we're then able to make an assessment and make the payment. And so that's the issue.
It's just that lack of being able to call someone up and sort of request help that we're hearing is a real barrier.
There's a team there. There's a business support line, and we're not waiting for calls. We're ringing people saying, you haven't responded to our emails for further information. Is there an issue? We're ringing them.
So for those businesses that haven't received a call or an email, we're hearing from them, texting in now as they're listening to this press conference. Is that because they haven't got an issue with their application and it will be paid soon?
That may well be the case. Will depend, of course, on when they submitted their application. So the advice I have is that there was 1,600 submitted on the first day, and then about another 900 came in on day 2, about 2,500 on the first 2 days, and then we're getting about 300 a day that have been each day since. So if you didn't submit your application until the 10th of September, then it's the ones that came in on the 26th of August are being assessed first. And 75% of those payments have already been made to more than 1,200 businesses. There's now 4,000 will cross over that number today, which is half of all of the applications already paid. Now, the people who put their applications in 2 days ago or last week, there is a queue in front of you. The people who submitted their applications in late August and early September. But we have, if I can find the sheet, about 1,200 that we are still awaiting further information from. So they're the ones, those 1,200 are the ones that are being contacted now because they put their applications in on the first 2 days. They've been sent a request to provide more information, but they haven't yet. Now, about 1,200, there were about 2,500 who hadn't fully completed their forms. Now, more than half of them have been able to provide the subsequent information and have been approved. So it's the other half who haven't yet, who are in that first group who applied in late August. They're the ones that we're following up with now. It is order of application is the basis in which the team are working through, seeking that further information.
The Chief Health Officer just spoke about the possibility of a cluster around the Watson area. Is it still your view that the ACT is too small a jurisdiction that you would have specific restrictions on certain suburbs or areas?
Well, look, if the Chief Health Officer advised that that was necessary and appropriate, then obviously that's a power that the Chief Health Officer has under the public health emergency. But I would consider it unlikely that we would have radically different arrangements within a jurisdiction of this size.
Questions for the Chief Health Officer?
Certainly. Thank you.
Chief Health Officer, the ACT government has faced several days now of criticism about the pathway forward. Residents are frustrated that there seems to be more detail around